Everyone. So my neuro technique is proprioceptive neuromuscular facilitation, other known as PNF. So just a little background on my client before we get started. He has Parkinson's disease. If you're not familiar with Parkinson's disease, it is a nervous system disorder which affects the body affects the gross motor movements, grip and grasp, mainly by those tremors. Tremors are uncontrollable shaking. So it's kind of hard for them to hold on to objects and things like that. With my client, he loves to exercise. That was one of the things that he really enjoyed before his diagnosis, and he still wants to incorporate that into his daily life, still with having Parkinson's. So with the use of PNF, I'm going to be able to show him how to do some strengthening exercises. That way he can have that sense of accomplishment that he's still able to engage in exercise on a daily basis. So with PNF, it's the use of diagonal patterns, and it's D1, D2 motion. So that has like flexion and extension incorporated into it as well. So I will start by having him start with his right hand, and he's going to place it by his left hip. And I'll call this motion like throwing the sword away. So as you grab that sword, and when you get to about midline, you're going to open your hand up like so, and then close your fist back and bring it back by your left hip. And I would have him repeat this motion about 5 times. And since tiredness and aching may be an issue, I will have him seated instead of standing. That way he can do his exercises sitting. So we're going to do 2 more. Alright, so I will have him repeat this motion with his left hand now on his right hip, and he would do the same thing, do the throwing the sword away motion, and 5 times. So same concept. Let's do 1 more. Alright, so he has now completed that motion. So then I would have him do a motion starting with his right hand again, and place it in the middle of his chest. And then he's going to take his arm down by his hip and let go as he gets down there, and bring it back up by his hip, not by his hip, by the middle of his chest, and bring it by his hip. And he can do that 5 times as well. Or since, 5 times can be the minimum, but you want to shoot for 5 times as the limit, Okay. And he will repeat that same thing with his left hand, the same pattern. And then the last strengthening exercise I would have him do is taking his right hand to right ear. So this is just full out flexion and extension, but on the same side. The other patterns that you see me do were going through different planes, and this one is just in the same plane. And then he will do the same thing for that, for this side. Left arm to left ear. Same thing. Now, I can upgrade this as well for the client, and I could do so by with the use of a TheraBand. And since my client really enjoys exercise, he can maybe start with these exercises, and then I would have him use a TheraBand. So I'm just going to demonstrate just just so you guys can imagine how I would do it with the TheraBand. So he will hold one end of the TheraBand. Say we're doing this motion with the sword. So he will hold the TheraBand right here, and he will grab the TheraBand with this hand, and he will take the TheraBand and move it up. Just like so, but with the use of a TheraBand. So that is my neuro technique video on PNF. So a client can still perform the IADL as for exercise, and he can still incorporate that into his daily life. He can still do something that is meaningful and purposeful for him. And with the use of having the chair, and that's going to contribute to him not getting as tired. And there you have it.
Hello everyone. So for my learning technique, I'm going to be doing the Rood approach with a client who suffers from Parkinson's disease. So a little bit about Parkinson's disease. It's a neuromuscular nervous system disorder that affects gross motor movements as well as some fine motor skills with grasp and grip. So basically the main symptom of Parkinson's is tremors. And what tremors are is it's uncontrollable shaking, usually in the upper extremities. And when the disease first starts out, they start off somewhat minor, almost unnoticeable, and they usually start out in the fingers as well as the hands. So that's why it affects a lot of people with their ability to grasp and grip objects. And then as the disease kind of progresses, it affects more gross motor and their ability to complete a lot of gross motor activities. And so that usually is what affects it. So for my client, so they do suffer from Parkinson's disease, but I'm going to do the Rood approach, and what we're going to work on is bed mobility. And I think that bed mobility is really important because it kind of gets the body going after being kind of inactive for several hours. And also it just keeps the body, all the muscles loosened and the joints loosened as well. So a little bit about the Rood approach. So it has to do a lot with motivation to do these certain activities, repetition. So during the bed mobility, we're going to be doing some range of motion exercises. So about 5 times each. So that includes the repetition, and weight bearing as well as joint compression. So this will help with the Parkinson's because of the gross motor. It'll help control the movements and kind of make, kind of stimulate the muscles a little bit more so that they're able to kind of control their tremors a little bit more, especially with the weight bearing aspect of it. So I'm going to start off doing some range of motion on the upper extremities of my client. So first I would start off by making sure that the patient is alert and ready to go and start their day. So that's get them kind of motivated a little bit. So now that I know that they're ready and they're motivated and alert to start their day, I would practice some passive range of motion on them. And while I do the passive range of motion on them, that is where I'm going to incorporate the joint compressions and kind of stimulate the muscles and joints in that aspect. So I'm going to do 5 reps on both sides of, I'm going to only demonstrate on one side, of flexion and extension of the shoulder, the elbow, and then the wrist. After each time, I'm going to compress the joints. So, shoulder flexion, extension, and then to compress the joint, you just lightly push up and then pull back down. So you do that 5 times, and then you move on to the elbow, you flex, and then you extend. And then again, just a light push and kind of stabilize the elbow and the upper arm there, kind of hold on, and then just lightly push the forearm in so that it compresses the joint. So just do that again, and then after each time, do the joint compression. And then we'll move on to the wrist. So you do flexion and extension, just like this. And then you would push down, and then flexion and extension, and push down. So we would do that on 5 times each. And then each time, joint compression. So then I would have them do that because they are able to independently do it on their own as well. So they can work on kind of getting those muscles activated. The next thing I would do, the weight bear aspect of it, is I would have them to sit up in bed. So I would have her put her hands behind her back, kind of to her side, and just kind of put all her body weight, transfer her body weight onto her back hands so that we are weight bearing. And then I would kind of push down a little bit, and that incorporates the joint compression as well. So I would have her kind of stay like that for a little bit, just kind of leaning back. Good. Good. So that incorporates the weight bearing aspect of it. So then I would have her come to the edge of the bed. And that would be our bed mobility. Both sides, just range of motion, incorporating the weight bearing and the joint compression to help with the activation of muscles and to help kind of loosen them if they're and the rigid movements. And yeah, so that about covers it. And then just with the bed mobility, it's important to get them motivated to start their day and all their activities.
And I'm motivated.
Yeah, good. All right. That's it.